It's time for our next local business highlight. Stay tuned and join me as we interview a very special guest. Welcome to the show. I'm your host, Betty Russo. I'm excited to share my best North Jersey lifestyle and real estate tips with you and so much more. On with the show. Hi, everyone. I am Betty Russo, and I'm here today with Dr. Darren Hartung of Oakland Family Chiropractic Center. Thank you for joining me, Doc. It's a pleasure to have you here. Yes. So why don't you tell us a little bit about your practice? Where are you located for starters?
We're located at 410 Ramapo Valley Road. It's right across from the Starbucks and the Walgreens, right next to 287 in the West Oakland Ave intersection.
Got it. Awesome location.
Yes.
So tell us a little bit about yourself. How did you get started in chiropractic? And do you have any specialties also that you might want to share with us?
Well, how I got started in chiropractic is kind of a long story. I had no intention of becoming a chiropractor.
Really?
Really, yeah. I mean, my goal was to go into law enforcement and federal law enforcement. It's a really long story, but I'll try to make it quick.
Okay.
So when I was younger, I hurt myself training, and it just didn't get better. Developed tonsillitis, developed ear issues, earaches. Had gone to a bunch of doctors, specifically ENTs. And in the end, they wanted to take my tonsils out, which I was deathly afraid. So with that, my mom had just started to see a chiropractor in town. Chiropractic was the new thing for us. And she begged me to go see him. He kept telling her, bring him in, bring him in. And so I finally went, respecting my mom's wishes, and was adjusted by him. And it absolutely changed my life. My problem cleared up within a couple of weeks. After months and months of suffering, I was able to head back to the gym and start to train again. And then from there, I said, wow, this is amazing what happened to me.
Mm-hmm.
And, can I become a chiropractor? Can I help people like I was helped? And then the rest is history. I just completely changed my career goals and decided to become a chiropractor.
Okay. So I also asked you if you had any, specialties, but before we even go to that, I mean, what you just said is a great lead-in to my next question. The reason it's a great lead-in is because you really just talked about like an ailment that you had that really you wouldn't imagine that a chiropractor would be the one to help you, right? So my next thing is I wanted to say, chiropractic care has so many benefits. For example, similar story, I brought my daughter to see you and she didn't want to. And I said, please, 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 you have to go see him, just like your mom did with you. But she had terrible headaches and you were able to help her. I also came in not too long ago with a really severely pulled muscle, and you were able to help me with that. So there are so many benefits, and most people don't realize that. So why don't you tell us like a little bit more about that? Like what other things can you help people with?
I think, well, just to back up a little bit, I think most of Americans, unfortunately, have been taught that health comes from a pill, or to seek health from a pill. Health doesn't come from a pill. So I guess the way I try, like I was helped, what I try to do is approach the body from a mechanical perspective. Why is that person having headaches and how does it relate to the spine? So many problems people have relate to the spine not functioning the way it should. We have an old saying in chiropractic, structure dictates function. So really what I try to do is correct those spinal misalignments and mobilize the spine. And then a lot of these ailments correct themselves. And so what I have to figure out is why the body is not healing itself. So I try to educate my patients. I tell them, when you cut yourself, you don't think about all the processes involved, what the body has to do, clot factors, your immune system coming in and taking care of an infection by itself. What you're responsible for is cleaning the wound, and then you forget about it. And the body puts down new skin. So the way we try to approach it is we don't want to use drugs. We certainly want to try to avoid surgery at all costs. What we want to do is use that innate, pre-programmed intelligence in the body. The body knows what to do. What we want to do is remove that interference. And a lot of times that interference is just related to a congested spine, a spine that's not moving properly, which in turn can lead to muscle spasm. Mm-hmm. Like in your daughter's case, her neck muscles were so tight, and that's a trigger. And really the headache is the only way the body can tell you at a conscious level, there's a problem, help me, right? And unfortunately, so many people, they take a pill. And it works, but it's temporary.
It's like a Band-Aid.
We really want to find that root cause, correct it, so that person can go on and live a healthy, happy lifestyle, pain-free.
So that's amazing that the spine is responsible for so many things, in your body. And it has a lot to do with the nervous system as well, right?
Yes, directly. It's directly related to the nervous system. I said we have an old saying in chiropractic that structure dictates function. If the structure breaks down, then the function breaks down, right? So not only does your spinal column, these 24 individual vertebrae, make you erect, right, give you support, but it also it protects the nerves, the spinal cord, right? Another thing I try to teach my patients is, the body has a lymphatic system and it has an electrical system. So the lymphatic system is like plumbing in a building. Mm-hmm. The electrical system is the nerves, right? It's like wires throughout your house, but everything is soft. So when you start to put pressure on them, what happens, right? You slow down the nerve impulses, right? And whether that's a motor nerve, a sensory nerve, I teach my patients, your organs don't have brains for themselves. Everything has to come from here. And the only way this can talk to everything else in the body is through the nerves. Mm-hmm. And when you compress a nerve, you don't necessarily have to have pain. It depends upon the nerve that's compressed, but it can decrease the function wherever that nerve is traveling to. So when we adjust the spine, chiropractors use the big word subluxation, which is really just a misalignment of the spine. And we try to correct that through specific adjustments. That's our goal. And then in turn, in correcting those subluxations, we're also mobilizing the joints. And that's a wonderful thing. We've all had the problem where we can't turn our necks. We feel like it's restricted. And then you get adjusted and you can make that full turn. So not only do you restoring motion, you're restoring function along with that.
Right. Interesting. Cool. So what are some other reasons that people would come to see you? Other ailments, just for example?
I have a lot of patients that come in with foot pain, plantar fasciitis.
Really?
Yeah. I mean, I know you asked earlier about specialties. The core specialty of what I do is chiropractic. That is the crux of what we do. Mm-hmm. That's where the healing starts, right? I mean, the body heals itself, but we're that vehicle for that patient. But orthotics, I will fit a patient through a 3D laser scanner. In the old days, we used to put a one-time collapsible foam to mold the foot and ship it off. Now, in the age of the internet and technology, we have this really, really neat 3D laser scanner that makes an image of the foot. We send it out through the internet to the company. The company sends us back a wonderful custom fitted orthotic for the patient, which brings me to a point. The feet, it's amazing because the foot is really the only part of your body. It is the only part of your body that makes contact with the ground. So when you think about the entire weight of your body going through the feet, so if the foot is out of alignment and not functioning correctly, it just transfers through the whole body. So we do that. And I mean, I know you mentioned earlier specialties. We'll use modalities that help us in facilitating healing, cold laser therapy, ultrasound, cryo, heat therapy, and then one-on-one range of motion therapy with the patient.
Awesome.
Sometimes when you go into a doctor's office, the doctor's here and the patient's here. And so I try not to do that. I try to get on the same level with the patient, and befriend them. I think it's very important to have a really good, friendly relationship with your patient so that they trust you.
Right.
Right. If a patient doesn't trust you, that visit isn't going to be as effective, is it? Right.
Yeah. We were just kind of
So,
talking about that with me too, the trust factor.
yeah. I mean, I think it's so important, not to sound corny here, but I think it's so important to love your patient. I mean, I really do appreciate my patients. I love them.
Yeah.
When I can help them with their pain, get them out of pain and improve their lifestyle, that is so rewarding to me. It makes it just makes me reflect how blessed I am to be able to help people.
Right.
Avoid them having to take, Advil or Aleve and live off of that stuff, which is not good for you. Right.
Yeah. Yeah. You know what I find really interesting? I always found this since I started coming to you was the fact that first of all, I always felt very comfortable there. I always say it when I come in. I love being here because, it's very welcoming and I feel like $1,000,000 when I leave. But also, I always liked the fact that you would explain everything. Like, I felt like you were so medically, knowledgeable, obviously, but, willing to share that knowledge. So, I mean, you would explain the different things that were happening in the body and the different parts and all of that, which I thought was very cool.
I think that's critical for a patient to understand their own anatomy. I mean, look, the way I see it is our body is a miraculous machine. If you don't understand your car I know this analogy is used a lot, but if you don't understand what an over temperature light means or low pressure warning, then how can you react to what the car is trying to tell you? So what I want to do is educate my patients about their body so that then when they feel pain, they don't look to the cabinet, the medicine cabinet. When they feel pain, they say, okay, what's going on with my body internally? What's happening? So when you have a problem, address it. Far too many people wait, and the longer you wait, the more serious the problem becomes. More scar tissue sets in, more stress on the nervous system. When your body is under duress, we just talk about stress for a moment. So I try to educate my patients on the 3 types of stress. There's chemical, there's emotional, and physical. And so how does chiropractic work with stress? And first of all, we know stress is the root cause of a lot of problems, right? A lot of breakdowns in the body. So chiropractic deals with really the physical stress. We want to remove the physical stress in the spinal column. If we can get the body working better, then it can handle emotional stress and chemical stress better. A perfect example of physical stress may be that you haven't slept well for 3 days, let's just say. Do you think you're going to be able to handle taking care of your children when they're saying, mommy, 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 or daddy, daddy, or even at work? You're not going to be able to concentrate.
Right.
So that will then in turn affect you emotionally, the emotional breakdown, you can't handle things, and then chemical breakdowns where the body becomes more susceptible to environmental exposure, whatever they may be, or alcohol, tobacco, or poor foods. So when we adjust that body, we're addressing the physical stress. We take that physical stress out, and then the body just works so much better. It can handle everything around it much better, much more efficiently.
It makes a lot of sense because, it's funny, we all know that stress affects the body terribly, but we don't really know how, so that was a great explanation. Thank you.
Yeah,
you're learning a lot from you as usual. So do you recommend regular maintenance to your patients? How does that work?
I do. I mean, my goal is not to see a patient 3 times a week for the rest of their lives. You have patients that do come in that have had experience with chiropractic, and in some certain offices they've had to go repetitively over and over again. My goal is to work a patient to once a month as quickly as possible. And I found in my 24 years of experience, once a month, which is 12 times a year, it's such a small moment in time for a patient when you think about it. just, 12 times a year, a whole year. Why once a month? Just to maintain, again, what I had said earlier, you don't want to wait till there's pain. And I always tell my patients, look, it's once a month. If you feel any pain, if you get a headache, anything that you feel is stress related, come in before then, don't wait. But I think maintenance is critical because we're all getting older. Out in the medical realm, they're always talking about arthritis. Well, what is arthritis? Well, the word groups, the way they're broken up in the Latin. Artho means joint. Itis is inflammation. So it's inflammation in a joint. But how do you get that arthritis, right? Well, there's some disease processes that happen, but overall, we all get arthritis. We're all slowly breaking down as we age. We all know age. We all know age, right? Age is not fun. So the way I look at it is, if I can say this, this may not sound very professional, but I love analogies, and I'm a mechanical guy. I love to fix things, and I think that's why I love fixing the body. But I am the WD-40. We all know that, right? I think we all know WD-40. I am the WD-40 on a rusted nut and bolt. This is an analogy I'll use with my patients. You take a brand new nut and bolt from Home Depot. You know that nut spins so freely on those threads. But if you take it outside, you stick it and it gets rained on and it gets weathered, what starts to happen? Oxidation, right? Rust sets in. That rust is arthritis.
Wow.
And the function of that nut and bolt starts to break down. You can't spin the nut on the bolt, right? But if I went out every day, and this is referring to maintenance, right? If I went out every day and I put a little bit of lubricant on it and I spun it, right? The function of that nut and bolt will remain. It doesn't look pretty. It's slowly degenerating with oxidation, but it's functioning.
Got it.
That's what chiropractic maintenance does. Long explanation.
Wow. But what a great explanation. I love this. I'm so glad we're having this conversation. This is fabulous.
Thank you.
Awesome.
Great.
So before I ask you our last question, basically how people can find you besides where you're located, we'll get to that. Is there anything that I missed that you want to share with us?
I don't think I think the last thing I would tell you is my approach to patient care is really to try to be at the same level with the patient. I think listening is critical. My office, I tried to maintain not a high volume practice. And I have nothing against those people that have high volume practices, but I think one of the breakdowns in healthcare for patients these days is doctor offices, whether medical, chiropractic, PT, what have you, have such a huge patient load that there's a breakdown of communication. You don't get enough time for the doctor to really listen to the patient. So I really try to love my patients. I think it's so important to really care, that loving care. I mean, that's really, why did we get into it? We didn't get into it for any other reason, but that we want to help people, right?
Exactly.
So yeah, in my office, it's really about listening and educating, as you've said, educating. And I think that's what really draws people back, and that trust factor.
Right.
So I think I would add that.
Yeah.
So,
Yes. So you know what? I can vouch for all of that because I have to say, I have hardly ever waited when I come into the office. If I sit down, it's for like 3 minutes.
Yeah.
But usually I go in right away. There's never a wait, and you always take your time with me. You are never in a rush to get out of that door. You answer all of my questions all the time, and it's very, very nice.
That's great. Then I'm doing my job.
So where can people find you now? We know where you're located. You're in Oakland. You're right in a great location, very visible in the middle of everything, which is awesome. But why don't you share your website address maybe? I know your website has a lot of great information. How else can people contact you?
Sure. Our website is Oakland Family Chiro. So the name of the town, Oakland, which we've been Oakland Family Chiropractic Center for 24 years. And we're in the, I know I had mentioned where we are. We're in the old historical building. I think it's one of the oldest buildings in Oakland, right? So
Love
we're on
that
that
building.
bottom floor, right? It's a gorgeous. I think it was the original post office way back when.
Wow.
Again, right across from that Starbucks. I mean, who doesn't know Starbucks? And so the website. We're on social media. We're on Facebook. I believe we're under OFCC on Facebook, right? Easy to find. And of course, Google, Twitter. All this Instagram. We're out there.
You're everywhere.
Yeah, we try to be. Right?
Okay. Very good.
Oh, and the number, I think the number is 201-337-3377.
Perfect.
It's an easy number.
Perfect. Very easy to remember. Great. So I guess that wraps it up. I appreciate you. I appreciate you taking this time to talk with me. And yeah, this was great.
So
great information.
Thank you for having me. I really appreciate that, Betty. Thank you so much. You're great.
You're welcome. So are you.
Thank you.
Take care.
Have a good day. Bye-bye.
You too. Thanks so much for watching. Please reach out to me on social media or visit northjerseyLifestyle.com. See you next week.